It's really great to be here today. Just for everybody on the call, Danny and I have been discussing a potential integration with PlumCheck and Enginehire, where our health verification service would be available to all of the customer agencies. I mean, I think the vision there is that we would be akin to true diligence, which I think you use for criminal background checks. We would be health checks. Um, I would like to take just maybe 10-15 minutes today to talk about what we have built at PlumCheck. And then I'm hoping to start a discussion and to get input and thoughts from the customer agencies. I'd like to learn about where your pain points and challenges are and how we might be able to help. So with that, I'm going to jump into a deck here. PlumCheck is a new company, and we're a novel service. We say we are building the plaid for health verification. If you know plaid or any of the other kind of infrastructure companies in the banking space, we are building the equivalent in health space. We are filling in what we see as a missing layer in the digital health ecosystem. I'm joined today by Sam Einhorn, our health data guru and senior product manager, and our medical advisor, Dr. Jeff Klausner, who is a clinical professor at the University of Southern California. Um, I got the idea for PlumCheck working on a hospital-funded data initiative. By way of my background, don't hold it against me, but I went to law school, and then I worked in politics for a long time. So it's like two strikes against me, I think, in a lot of people's views. But it was a journey, and I learned a lot about healthcare and health data in my Senate job. And then when I moved over to this data interoperability initiative. I saw, on the one hand, what great progress we've made in the United States on the digitization of electronic records over the past couple decades, and on the other hand, what challenges remain. And the idea from PlumCheck initially came from my experience in that job and my experience as a single guy on dating apps and not having a mechanism to exchange verified health information with prospective dates. I built a tool for that and realized it can do so much more. One of the reasons I'm excited about my conversations with Danny and with you all today is just how varied Enginehire is. It's really a unique platform, unique company with different types of customer agencies in, I think, largely overlapping but different spaces. As I mentioned, we're a new company with a novel service, and we are looking for input on how to sequence our availability and our launch. We'll get to that in a little bit. But first, just very high level, I think that there was some background on PlumCheck in the invitation email to this webinar. We are an API-based health verification service. We can verify things like, is a candidate vaccinated for the flu and COVID? Has a candidate had a TB test? And many other types of health information. At the end of the day, we we think we are offering, and we want to hear from you, several different types of value to allow you to, by offering verification, to attract health conscious customers. And to the extent that you are already complying with regulations and doing health verification in sort of the old-fashioned way, how we can reduce your paperwork and make you more efficient. And at the end of the day, it's all about increasing trust. More specifically, our technology will automate the verification process. It eliminates the need for clunky things like PDFs and screenshots and manual review. We distill everything down to clear, simple status badges. And you can avoid handling any personal health information and any liability related to that. We did a nationwide survey a few months ago in the caregiving vertical. And this was one survey where the results came back even stronger than I was hoping for. We asked in a few different questions whether people would prefer to hire caregivers who could prove COVID and flu vaccination. And over 80%, closer to 85% said yes. And 68% said they would be willing to pay extra for this type of verification. And the context of the survey was an app like care.com, where you would go, a marketplace app where you would go to hire a babysitter or an elder caregiver or a nanny. So these would be, I think, these survey participants are equivalent to your agency customers, those who are making hiring decisions. Um, the slide looks complicated, but I just want to kind of point out a couple of things, just to kind of give you an overview of the structure of our infrastructure. So I'll start by prefacing that we are only available in the United States right now. I understand from Danny something like upwards of a third of your agencies are not in the United States. And we are very actively exploring the Canadian market and other places. So definitely want to hear if there's demand there. In the United States, what we do is enabled by federal regulations that are relatively new that require electronic health systems. These are the computers at the doctor's office that store all of the digital health information. And there are new regulations in the United States that require them to have accessible APIs to respond to patient requests for core categories of their own health information. And fortunately for PlumCheck, and I'm hoping others on this call, patients can delegate that authority to a third party like PlumCheck. So everything we do is consent based. I'll show you on the next screen what the flow looks like in practice. But it all starts with the consent of the, say, job applicant who is going to be sharing health information. She would authorize us to obtain her health records. We ingest the health records wherever they happen to live. We have very good coverage of our API network and connections within the United States. So if there are electronic health records, strong chances we can access them. We then take the raw health record and we run it through a logic-powered translation layer. And I think the best way to illustrate this is with an example. If you were to look at what's in an electronic health record for yourself at, say, your primary care provider, there are probably things that would jump out and be readable to you, your name and address and certain types of health info. And there would be others that would not be as meaningful because they require knowledge to understand. So one example is take a vaccination, the HPV vaccination, for example, which is really important to women's health, which can prevent ovarian cancer. Depending on your age, when you get your first dose of the vaccine, you need either two or three injections, and they have to be certain durations apart. And if you were to just look at, three dates for getting a vaccination, you wouldn't know necessarily if that was in compliance with what in the US the CDC says constitutes a vaccination and having completed that course. Our logic layer does that and distills it down to essentially a check mark at the end of the day. And then we plug our API into our partner customer platforms like Enginehire. And that information can be shared in the partner ecosystem. On this page, Yeah, this is maybe a little bit more meaningful. This is what it actually looks like for a caregiver sharing her health record. So if you have, say, a nanny agency and you have an applicant who's filling out a profile and wants to provide this information, she would create a PlumCheck account within the Enginehire environment. It's all a very smooth flow. The user doesn't, there's no kind of web pop up where you feel like you're leaving. You're in that environment. You create an account. Part of the account creation is doing an identity verification, which we use Clear, a company that you may know from the airport. This is important so we know that the person who is setting up this profile is the same person as owns the health account. It's a necessary step to avoid fraud and to further ensure verification. We get the authorization to obtain the person's records. We do all of the magic I showed you on the prior screen. And then in step three there, you could see, what the profile might look like. Depending on how you have set up your instance of Enginehire, it would look something like this. And, a family looking to hire a nanny could see that Kirsten here is COVID and flu vaccinated and Tdap vaccinated and can make more confident hiring decision with that knowledge. Not going to go through this in any detail. My product manager, Sam, told me to take this slide out, but I like it because it shows that we have put a ton of work into complying with the HIPAA law to keep all of the health records secure and private and safe. So in the US, the HIPAA law only applies to certain types of entities. It doesn't really apply to third-party apps. But when I started PlumCheck, I said, regardless of whether we have to comply with these requirements, I want to. I want to build a service that people can trust, where you can feel safe that you're sharing your health records with only the recipients that you intend to share them with. And then, relatedly, I think one of our big selling points, frankly, is we do the health verification so you don't have to, and we do it in a way that minimizes your liability. So, I get the question all the time. People say this is interesting. Why doesn't it exist already? Why don't various platforms already do health verification? There are a few answers to that question, but I think people are squeamish, rightfully so, about any liability involved in touching protected health information. With PlumCheck, you don't have to. With PlumCheck, and there are some details that we need to sort out with respect to individual use cases, but you don't have to store anything on your own servers. So we're just completing an integration with another type of an app. It's a dating app actually, and our API is only to that app's front end, which allows users to share the check marks that they meet, that they have certain statuses without the dating app itself having any of that information on its servers. So I can get into more of that if there are questions, but that is, I think, a big advantage to this structure. Another thing I'd like to chat through with you all today is just potential use cases. So, like I said, this vision started with dating apps and people sharing sexual health information. We built a platform, however, that is completely use case agnostic. We can verify any type of health information that lives in the electronic health record. My mind, initially has gone to vaccinations when it comes to the caregiving space. But I'm very curious today to hear if there are other types of verification that would be useful for you. We can do everything from the date somebody got their last physical exam to things like TB testing or specific lab results or even allergies. I'm not sure where that would fit in the caregiving space, but it might somewhere. So really looking forward to getting your thoughts on that. And then, like I said, I'd really like to use most of the time today to the extent that people do have questions and ideas for discussion. And I just wanted to share some questions to kick that off. First question, because again, I know that you're in maybe all 50 states or most of them, different areas, different sets of regulatory requirements and burden. I'm interested if any of the agencies listening in have any health related compliance burdens today, and how you're dealing with it, what difficulties you might be having. Um, then, I'm interested, like I said on the prior slide, into specific settings where health information might make it easier to place job candidates or to do other functions in your agencies. We've done our nationwide survey and we've talked to lots of parents anecdotally, and we think there's interest. But I'd love to hear from you. Have your customers, have the people hiring through your services asked for any health related verification? And if so, was it COVID specific? Was it for other other types of health information? And then, what categories of health information do you think would be useful for your agency to be able to verify? And then finally, I don't want to like get ahead of my skis here. Danny and I have been discussing a potential integration. We haven't, agreed to anything or set a plan yet. But I think that we would probably sequence an integration in two parts, with an initial part that was focused on a smaller set of customer agencies, and limited categories of health information. And should that succeed, we would move on to a second and broader step that would be available to everyone, where we would start with a list of health statuses, and that list would grow over time. Again, we are a new company. We're still building our infrastructure. It's fully functional. We've had a functional infrastructure that's been doing verification since earlier this year, but we're still growing. And I think one of the really cool things about early partnerships with startups is you can help us to sequence our growth. And if we hear from you that certain things are particularly valuable for you, we can sequence that ahead of other things on our roadmap. So that is the end of my presentation. You don't have to listen to me talk for another 20 minutes. I don't know how many people are on this call live, but I would love to hear from you if you are. If you're not on the call live, if you're watching this after the fact, my contact information is on this slide, and Danny may send it around as well. But feel free to email me or text me. I tend not to answer calls from numbers I don't recognize, but I'm sure you'll be able to get a hold of me. Happy to talk to any of you one on one to talk about your interests and challenges. So thank you.
Josh, thank you so much for all of that. Um, I actually do have a question. I have a feeling there's a few other people on here that I know that love asking questions, so I wonder if they'll jump in at any point. But I was wondering, like, is there anything that agencies shouldn't know when it comes to health verification? If that like becomes a conflict in some way, or like if you know anything about that, that's a yeah.
I'd say a few things here. I'd say, for all sorts of reasons, you don't want to know more than you need to know about health information. And I think PlumCheck really threads the needle there to the point where you don't even have to store the information. But if you are interested in whether a job candidate is flu or COVID vaccinated, you don't want them to send you their entire health record. And actually, that happens nowadays more often than you might think. I think a lot of health verification nowadays is ad hoc. People take screenshots of their test results and they send it, by email, or they send PDFs of, their full set of results from their physical when it's only one or two pieces of information that are relevant. So you can kind of narrow that down. In terms of, I mean, are there types of information that would be that you wouldn't want to know for like employment law reasons? I can't answer that readily. It's certainly a good question. We haven't encountered that to date, but certainly something that we can address if it is a concern for anyone.
Awesome. No, thank you. Actually, that led me to like one follow-up question in this because of how it's set up to where like you get the person's consent and like they're like, yeah, I'm sharing this, and which I actually think is really remarkable in how important this is because, like you mentioned, if someone was to just share like their full physical report, now that's in this agency's database forever unless they happen to delete it, which even if they delete that candidate or whatever, it still might be living in there, and like that's kind of unfair to that person, that they've shared, like you said, probably more than they needed to. Is there a part wherever, and I'm sorry to put you on the spot here, but it just had
Mhm,
me thinking of like
mhm.
they like the candidate being like, I no longer want to share any of this information.
Yeah. Great question. And we put a lot of thought and frankly lawyer money into constructing our privacy policy in terms of use. And anybody who uses the PlumCheck platform at any time can delete their account, and we will destroy all of their information where it lives on our servers. We also only hold on to the raw health information for a limited period of time, after which we destroy it. And all we would hold on to on our servers is those medallions, those translated statuses. But we will destroy even those on request. So yeah, really great question, and something we've put a lot of thought and money into.
And I was just wondering for your team that's here, like, what is it that brought you to Plum Check?
So my name is Sam. I'm a product manager. I've been working for Josh for a while. He brought this idea to me I think for the first time at a bar in Brooklyn a couple of years ago. Um, and I remember when he first described the concept to me, I found that it was one of those this doesn't already exist moments, which is frankly the kind of moment that I'm looking for when I listen for a new idea. It's like, wait, how come this doesn't exist already? It seems like it should. Um, my background is in like the healthcare data integration side. So on the one hand, I understand like some of the technical barriers that make it difficult to access this information that, Josh and our team have overcome, although there are always additional barriers and hurdles. But I found that for me, PlumCheck is the kind of idea that is intuitive to people. Since joining the company, I've found that when I explain it to people that know nothing about healthcare data, but are, patients that receive healthcare in the United States, it's very easy to explain the problem. It resonates with people, and they are interested in solving it in it being solved for a variety of reasons. The dating app use case is a really relevant one to a lot of people. I think people find that to be particularly um, applicable. Um, I am knowing increasingly people that are in search of childcare in my life, and you know, I live in Brooklyn, New York City, and it is so difficult to keep your kids healthy, and so any additional peace of mind that can come from the verification of a nanny's health information can go a really long way. So there's a number of use cases that are exciting and that I think are just so relevant. I think healthcare data can be technical and weedy, and so I think that what attracted me to this company was how relevant and applicable this technology is to so many human beings that are in my life and, in my communities.
HIPAA is something that we've been super conscious of since the beginning. And we did something that's a bit unusual, I think, for a tech startup, but I'm glad we sequenced things this way. We spent money on lawyers to sort through all the regulatory issues before we built any technology, because we wanted to make sure that we were clear to do this. So when it comes to HIPAA compliance, we are not a covered entity. But we have nonetheless opted to abide by all of the technical requirements of HIPAA as if we were covered by the statute. Um, People are, more generally, I know that there's a lot of angst around HIPAA. I think we all have the experience of going to the doctor and having to like sign our name like 10 times for one visit on HIPAA forms. It seems that way at least. Um, uh, HIPAA is about protecting a patient privacy, but it's still up to the individual patient to whom they want to share and disclose records to. So any we're and to answer the HIPAA question, we're not covered by HIPAA. We're abiding by many of the requirements as if we were, and we get authorization from the patient user to access their records and to share their records as they direct, which even if we were covered by HIPAA would make us in compliance. You also had a question about potential EEOC issues. That's not something that our lawyers have flagged for us. I'd be happy to further discuss if you have a little bit more detail of the particular case you have in mind. But we have done a broad-based regulatory review of the platform, and that has not come up. And I think
It
Jeff
looks
was
like
gonna.
sorry, I was saying it looks like there's a second half of the question too, as far as the physical requirements of the role. But Jeff, yeah, please jump in.
Sure. I was going to say, as a physician in practice, I get requests for information, or our clinic gets requests for information continuously, right? So all day, every day, and conventionally make it difficult to fulfill those requests. Those requests often have to come in by fax. Responses have to come in by fax. So having a tool like PlumCheck that compliantly plugs into our medical record system, takes all that extra effort and delays off the clinical staff. And, you know, as a physician, I really believe that the medical information is owned by the patient, not by the, healthcare organization or the, medical provider. Historically, that information was used for billing, but now we recognize there's other opportunities to use that medical information, such as employment or employers looking for health verification. So to me, this deburdens the requirements for the healthcare staff, enables people to have full access in a secure means to their health information to be able to share with potential employers. So it's kind of a win-win for everybody involved. So while PlumCheck is not what's technically called a HIPAA covered, it is HIPAA compliant. So not every entity, not your local bowling alley, restaurant is considered a HIPAA covered organization that's involved in the delivery of healthcare or insurance or laboratory information. But being HIPAA compliant means that it can fully play in that field with other entities. And for
um,
me, enabling people to have better access to health information is really an issue of, human empowerment and breaking down barriers and now enabling systems to work more smoothly. Over.
Thanks, Jeff. I just wanted to to add to your comments that we we verify health information in several different ways. And very importantly, we get the information from the electronic health record source. When you, as a practicing physician, have to, fax something over, have to print something out, and dare I say, write something in your notoriously bad handwriting, there's a higher chance that information will be lost or misconveyed. And we avoid that by plugging into kind of the closest thing to the source of truth with health data, what has been, digitally inputted into the electronic health record system. Um, I see there are a couple of other questions here. Taja asked, again about regulations like HIPAA, and anything specific to employee health data. I would say, again, we haven't, we are not a HIPAA covered entity. We're complying with HIPAA technical requirements nonetheless. When it comes to any requirements for specific employers and types of employees, there may be regulations particular to that segment. So, we would need to know a little bit more about the context there. And then when it comes to, let's see, the next question. So yeah, nothing that we verify is self-reported. And that's really important too. Nothing self-reported and nothing is self-inputted. There have been challenges in building our infrastructure. We've solved a lot of them. There will be challenges ahead. One thing that we decided not to do is to allow people to upload PDFs. And why don't we allow that? Because those can be forged. We are able to say this information is verified because it comes from the source. We are, everything comes from the source there. When it comes to, the step beyond that, which I mentioned earlier, the translation layer, that is, we have Jeff and we've had other advisors advise on the logic that we use to take that health data and to use it to determine statuses. And that is, we are US limited to begin with. We have based all of that on CDC guidance on, what needs to be in place to qualify for a certain status. We can, you asked about TB tests and recent flu and COVID. Absolutely. That's exactly the type of verification that we do, and exactly what we expected this community would have an interest in addition to other things. And I think there's one more question here. Easily submit current health clearances. Um, Yes, I mean this is something, and one of the reasons we wanted to do this webinar is to have a better sense of your use cases. I think, Tadra, what you described there, which is essentially a doctor's note to say this person is no longer infected or can return to work. That's something that we certainly can do. And we are in the process of sequencing our infrastructure. We think Enginehire is a really cool company and a really cool prospective partner. And we're interested in working on some of these pieces of the infrastructure next. But that is not one that we have talked about internally. We can certainly discuss it, but at the end of the day, anything that would be based on information in the health system, the electronic health record, is something we can verify. So, it would probably depend in part on what the illness was, and what the clearance for that illness looks like. So, if it is an issue of getting a test, and we have the test record, we can obviously verify that. If it's more complicated, we could probably do that as well, but we need to think it through. We also have a question about pre-employment drug screenings. This is actually something we were, as a team, just discussing. And again, this is something that I would envision, when we are fully launched and integrated, would be part of the suite of services that we would offer. Really want to know more about what the challenges and opportunities are on the ground. It's all well and good for a really smart doctor like Jeff and a data expert like Sam and a startup guy like me to brainstorm on how people will use our technology. But it's much more valuable to hear from you all. So please do get in touch. We have a website, plumcheck.io. I will, Danny, I don't know if you typically send follow-up emails after the webinars, but please do include the deck so people can have that information. And again, I'm happy to schedule follow-up meetings to discuss anything people would like. And I just end by saying, again, eager to learn more, have discussions. We're really interested in working with Enginehire. And should we move forward, what we need to figure out relatively soon is where we're going to start. And like I said, I would envision a first phase where we have a limited number of customer agencies and an initial focus of certain types of health information. And we get that structure in place, to demonstrate its efficacy, and then ultimately make the API service available to all of the agency customers. But as I said before, there's sort of a first mover advantage if you see value here. We are still a relatively small team. I wish I had the budget to hire 50 more engineers, and then we could maybe do everything quickly. But if we're doing TB tests, we might, if that's the interest, we might sequence that ahead of the flu COVID functionality, or factor in other things. But we really need to hear from you guys about where your pain points are and where the value in PlumCheck would lie for you.
That's wonderful.
I would just say thank you, Danny, for setting up this call and for this opportunity, and really looking forward to continuing this discussion.
Wonderful. Well, everybody, thank you so much for joining us, and I will send this recording out as soon as possible.
Thanks, everyone.